60 years female, and this is a case of multiple gallbladder calculi. This is the superior inferior section of the gallbladder, and here you can see this is the gallbladder. And there is posterior shadow because the whole of the lumen of the gallbladder is occupied with this calculi, multiple calculi. These are the posterior acoustic shadows which we see due to the presence of calculi. Sometimes gallbladder lumen is not visualized properly due to the calculi which occupy whole of the lumen of this gallbladder. This is typical wall echo shadow complex, WES complex, that we call. This whole of this shadow here we see due to the calculi, and we are not able to visualize the gallbladder lumen. These kind of calculi are very common to be missed when you are a fresher, because you cannot see the gallbladder lumen properly, and due to this shadow you cannot see the calculi also very clearly. But these are the margin of the calculi, this, and this whole gallbladder. Yes, here you can see the calculi at the fundal side. These are the calculi. This is the fundus of the gallbladder, which is little bit empty without calculi. This is the fundus, and this is the wall echo shadow. In transverse view you will not be able to appreciate sometime, due to whenever especially the patient is fatty, as in this case this patient is fatty, overweight, and we cannot visualize the transverse section of the liver so clearly. So the only way to visualize the gallbladder is in the longitudinal section. This is the transverse section of the liver, and gallbladder might be somewhere over here, but we are not able to visualize it due to the gas and the fatty patient, which is not favorable condition for visualizing the gallbladder. But here once again in longitudinal view we can clearly see the gallbladder, this posterior shadow. Normally we should see this whole of the gallbladder like this, but this wall is not seen, is due to the calculus. This is the proper sagittal proper longitudinal section of the gallbladder. And one more thing to tell you is that first of all you should know to take the proper longitudinal section of the gallbladder, then only you can make out this diagnosis. Otherwise intestine can also give similar type of appearance when you have not seen sufficiently these type of cases. You will feel like the intestine shadow also like this. But first of all try to visualize the normal bladder with proper lumen, anechoic lumen.
open operation